to Benita's maternity program antenatal class. Today we're speaking with Sister Talia about cracked nipples during breastfeeding and how to treat this. Hi, Sister Talia.
Hi, everyone. Hi, good day. Yes, so this is quite a big healthcare concern. A lot of moms call us in with the cracked nipples during breastfeeding. This is quite a common healthcare question. So we are so happy when we hear this so that we can assist moms. It's quite a common condition that can be treated. So this is quite simple to treat. We must first look at the reasons why this happens before we can actually treat the condition of cracked nipples. So incorrect latching, that's number one. So latching is basically the way your baby takes the nipple into the mouth, short of a proper latch, which can sometimes make the nipple quite sore. So baby's mouth is over the nipple and it's just not grabbing correctly. So you have this kind of inconsistent latching, which can cause, the skin of the nipple is quite sensitive as well. So how do we properly latch our baby? So how do we do that? With time and patience. A baby does not just know how to latch. We seem to think, nature knows that it must drink, but not to latch. So what do? We try and get the nipple in as well as part of the darkened area of the nipple and the surrounding areola. Why? Because this will actually help get the milk out. So the milk needs to have some force to get out, and it will also help with the flow of the milk. And with that, it will cause less stress on the skin and the nipple area, which would cause cracking and sore nipples as well. So how do we get baby latch? Step by step. So once your baby is in the right position, you take basically your one free hand, you place your thumb above your nipple and areola at the spot where your baby's nose will touch the breast. Your index fingers should be in the spot where your baby's chin will touch the breast. Lightly compress your breast. So it's giving it a bit of shape and it resembles the baby's mouth. So I always tell people it's almost like you're tugging on your shirt. That's similar before you actually get the baby's mouth in there. And after doing that, you bring your baby to your breast. Stroke the cheek so it will allow that reflex of suctioning. And then you turn the mouth toward your breast. You can tickle the baba's lips a bit just under the nipple and with the nipple in the mouth until they open nice and wide like a yawn, and the mouth should then be sufficient to get the nipple in. Quickly bring baby to the breast without pushing. So remember, you're not pushing the head or squashing it in. It's quite a natural, but we're just assisting to get everything in that we want into the mouth. So it must be the nipple and the areola. So what is the areola? It's the darkened area around the nipple. When to know a latch works? This is quite a big question we get. You'll know you have a proper latch if your chin and your tip of your nose are touching your breast. You'll also notice the lips flange. It's almost like a fish instead of being tucked in. Let the feeding begin once you got the proper latch. Your baby will fall right into the suck and swallow breath pattern. So they will start drinking, and you can actually feel it. It's such a relief. Your breast would be emptying as well, and you can see your baby's motion. It's strong, but it's not forceful. They're not trying against nothing really working. So now we have a few more questions. So we normally have the question, but what if my nipples are inverted and smaller nipples? So in the past, people used to say there's no such thing. You tug your nipples, you pull it and it will enlarge. That's not true, because we were all made unique. We all have different breast sizes and different nipple sizes as well. But greatly, we now have something called a nipple shield. So it's a device that was formulated, and it is actually there to assist moms. We use it in the labor rooms as well when we're suctioning baby and there's difficulty latching. And we use it for the reason it protects the nipples, it helps moms, and it relieves anxiety and stress. And we want our baby to feed ultimately. So the improper use of a nipple shield could lead to breast supply, lower supply, weight loss in your baby, and breast issues. So it's very important to use it recommendedly, correctly as well. There's an issue with your baby's mouth or tongue that's affecting the latch. So we hear of papas having a bit of a cleft palate, also tongue tie. Then doctors would prescribe, but also when the nipples are very short, inverted, it doesn't reach the roof of baby's mouth, or sucking reflex is just not there. that would be a reason to recommend a nipple shield. So there I have a pic, nipple stands and how to clean it. So I have a great nipple shield I love, and most maternity units like it, is the Medulla. Why do we like it? It's soft, it's silicone, it fits over the nipple and the areola, and it can keep baby latch on properly so that both get used to breastfeeding. Research has shown that premature infants who nurse with nipple shields intake more milk than infants who don't use nipple shields when nursing. So now we've got these two things, we are using it. How do we clean it? So first, rinse it with cold water. This is after each and every feed. Then wash it in hot soapy water, removing all milky residue. Remember, it's small babas, we don't want to spread bacteria. Then we rinse it well with clean cold water. I normally tell moms there's two ways to do it. If you have a little rack, you can air dry it in there with clean paper towel, or you can store it in a container with a lid, just to prevent contamination. It's similar to how you would treat a bottle feeding baby, except it's not microwave savable, and it's also not safe to use in the dishwasher because it is soft silicone. It's quite flexible as well. So treatments. Now we've looked at the ways that causes the nipples to crack, but what do we do? How do we treat the sore nipples once it's there? Firstly, we wash our hands with soap and water before each feeding. So you don't touch your breast when your hands are not clean, because we don't want to spread an infection. Remember, skin can be open, so that's breeding ground for bacteria. It's warmth. So remember, any breastfeeding nipple is warm because there's continuous flow of milk. It's damp. It's always wet. And that is the things that bacteria thrive on. That's why we need to keep our hands clean. We wear cotton, clean cotton every day. So I know when you are breastfeeding, you have one or two of those nursing bras, and then it may, get lost in the baby bundle of washing. Do you have time to wash now? But please, if you don't have nursing bras enough, you can use normal bras as long as it's cotton and breathable. It's actually the breathability of the cotton material and changing daily so that we don't have wetness, and the area that stays moist and wetness is that breeding ground for the bacteria. So we're also going to avoid soaps and shampoo on your nipples. Why? It's too harsh. The skin is already so fragile, it's going through so much, being sucked at and pulled up every day, to now add that as well. And after each feeding, I personally have used this product with all three of my kids, and we as the midwives, we normally do give a little pot if we can get it during the postnatal stage in hospital. So Bepanthen bum cream, yes, a bum cream. We put it on the nipple area, a thin layer, and when that is after feeding your baba. So your baba is fed, baby's put away, and now you're going to treat your nipples. So you're going to first add a thin layer of Bepanthen bum cream. But now I need to feed my baby again. You need to wipe it off. How? Gently, with a dry, soft cloth before each feed. I normally tell mom, keep a nice, dry, soft cloth nearby, and just keep it for that reasons. And obviously rinse the cloth in between with nice soapy water to keep it nice and clean. This will help nourish. So the bum cream, actually, what it does, it nourishes, it protects the nipples, just like it does with the baby's bum. Remember, there's wetness all the time going there, so it creates a barrier of protection. Fifthly, detach the nipple gently. I've had moms that baby is sucking and they just grab the baby's head and they take it out. It's going to hurt you. That force, because when they suction, it's so hard and so intensely that you will hurt your skin. And clean your nipples gently. Please be gentle. People give you all sorts of things to rub on to harden your nipples. There's no such thing. You're just going to harden and hurt your skin, actually. Take pain relief tablets. So if your nipples are really cracked, sore, painful, it is very uncomfortable for moms. So while the Bepanthen takes a day or two to kick in and start forming that barrier of protection on your skin, take 2 Panados every 6 hours for pain relief, but please don't go over 24-hour period. If you do go over that period, you're actually going to hurt yourself, because you may cause constipation or anything else if you take too long pain tablets.